I owe a great deal of thanks to all of the people here that made such valuable contributions to make this center a reality. And you helped bring what was a dream about care, about screening, about diagnostics, and about treatment, and creating a premier center of a comprehensive care approach with everything under one roof.
Let me thank you, for making that vision a reality. 2 years ago at Yankee Stadium, I was at a game and someone introduced me to somebody else, and she said, "Oh, you're the guy from Montefiore?" I said, "Yes." She said, "Well, let me talk to you about women's health." That person was Council Member Marjorie Velasquez. She's the real deal. I'm telling you. Thank you for being here. She's not just here for a photo op. She believes in these issues. She's knowledgeable. She's passionate about it, and it's good to see you here, Council Member. Thank you for being here.
You're going to give so many patients an opportunity for a better way of life. For me and my family, breast cancer has taken some of my loved ones, but luckily for folks that were able to catch it early, they were saved. And that's my mom. She was saved. And now giving this opportunity for so many other women. Look, I'm 42. And so for my own birthday, when I turned 40, it was important to me to get my mammogram and to get screened. However, being young at 40, you have to do this and that. You have to do a sonogram and a mammogram. And so having it all together here in one spot gives us a sense of sanity. For your vision, Dr. Feldman, to understand that's what we're talking about, the Bronx being innovators. The Bronx will be a leader, and know that we're your number one supporters, because you don't get that most times, right? You don't get people to come back to you and say thank you. So guess what? Thank you for all your hard work.
It really gives me great pleasure to introduce Dr. Shelley Feldman, who's Professor and Chief of Breast Surgery and Breast Surgical Oncology and Director of Breast Cancer Services at the Montefiore Einstein Comprehensive Cancer Center. It's always been Shelley's dream and vision to have this breast care center, to really have a center that would offer our patients state-of-the-art multidisciplinary care and also to provide cutting-edge clinical research. Dr. Feldman is an international expert in the field of breast cancer surgery, and his focus has been on developing minimally invasive surgical approaches and also incorporating intraoperative radiation. He's also been very actively involved in incorporating complementary integrative medicine approaches as a key element of breast cancer treatment, which obviously is near and dear to my own heart, as I've also spent the last 20 plus years also trying to integrate integrative complementary medicine as part of new treatment regimens.
The fact that we could create a center like this that would benefit so many patients who have such difficult lives really meant so much to me. We don't want barriers to our patients from the community to have to wait, be delayed in terms of diagnosis and treatment. We wanted to do it in a healing environment such as this.
This houses the latest in breast imaging technology, and we are all devoted to improving women's health care in the Bronx and beyond. The Pristina units are absolutely state-of-the-art. We will have what's called the sensory suite, which really appeals to patients. So it has the softer lighting, the rounded curved edges, much more comfortable for the patient experience. We have the Duetta, and this allows patients to actually self-compress. And I think a lot of the folks who have had mammograms will understand that this causes fear in patients and pain in patients occasionally. So this option is fantastic for patients. We'll be able to perform contrast-enhanced mammography. So we inject IV contrast and we'll be able to highlight abnormal areas of blood flow to increase specificity, decrease false positives, decrease the number of unnecessary biopsies, and even unnecessary surgeries. We'll also have available what's called profound artificial intelligence, which will help our radiologists spot those lesions even more quickly and more accurately.
It's been an honor to be able to participate and do whatever we could as an institution to support Dr. Feldman's vision.
Really, the star of today is one of the most amazing people I've ever met. Her name is Michele Eiley. She's had a very, very, very difficult life. She's had a very challenging path and so many obstacles and difficulties to overcome that most people would be crushed by, that she was able to overcome. And then kind of just as she was getting through a lot of that, she was diagnosed with breast cancer. And within the year, just to give you an idea of how many people have touched her and her care, she's been involved with breast surgery, with plastic surgery, with medical oncology, with radiation oncology, with social work, with behavioral medicine, with nutrition, with breast imaging, with cardiology, with orthopedics. These are all the components, and then of course all the nurses and nurse practitioners and the operating room staff. I mean, it's a village, it takes a village sometimes. So, and she has come through all of this with such grace and positive attitude and perseverance to help others, to help her own children, just to be there, to survive, and to make it better for the others to come. So Michele, so glad you could be with us. Please come up and say a few words.
My name is Michele Eiley. It's a pleasure to be here today, watching all of y'all. I want to say thank you to my doctor, Dr. Sherman. You have given me a chance to live, to remember, and to overcome. I'm diagnosed with breast cancer. I remember lying on my bed, think I would never see October, just the other month ahead. And when I met my doctor, and he walked in that room, there was a light I saw. And that light is the light right now. All of you seeing me. Because of him and his staff, I was able to stand right here to say, I am and I will be a survivor.
All of you, my colleagues, for what you do every day and the way in which you do it. Thank you all.